Let's start our today lecture. Today lecture is not too long. We will discuss some endocrinic disorders and some epidemiology. So let's start our lecture. Diabetes mellitus. When you hear diabetes mellitus, think of a key and lock problem. Like insulin is the key that unlocks the body cells to allow glucose for energy. Okay. Basically, in dogs, there is a diabetes type 1. In diabetes type 1, basically, the pancreatic beta cells are destroyed, maybe due to any pathological condition or immune mediated disorders, and they don't produce enough insulin. Maybe it is congenital or maybe pathological. So, insulin therapy is required here. But in cat, there is diabetes type 2. Body cell never respond or low response of the body cell to the glucose. So here is the obesity, fat deposition is the risk, and some cat can even go into the reoccurrence. So dietary change, insulin therapy, most important in the cat. So basically, in dog, the most clinical sign is cataract. Cataract is common in the dogs. Okay, you should remember cataract is more common in the dog, and basically here the sugar sorbitol accumulate in the eyeball that allow water into the eyeball and increase the ocular pressure. So osmotic drainage is important here, and in dog pancreatitis is also the main problem, which leads to the diabetes mellitus. So here the clinical sign, polyuria, polydipsia, cataract, high blood glucose. But in cat, cataract is not common and rare. So you have a dog or cat have polydipsia, polyuria, polyphagia, excess hunger, weight loss, and dog may develop cataract. So diagnosis: high blood glucose, sugar, and glycosuria, sugar in the urine. So treatment is basically the insulin, especially in the dogs, and for cat we use insulin, but also emphasize on the high protein and low carb diet. Okay, so let us say it's not opening. So here, diabetes mellitus dog, we use intermediate acting insulin, and the gold standard treatment for our dogs is intermediate insulin. So alternative is NPH insulin. But in cat, we prefer long-acting insulin like Garjanine, Detamar. We also use intermediate, but first priority is the long-acting insulin. With dietary changes, in horses it is uncommon, and it is mostly due to the secondary effect of pituitary pars intermedia dysfunction, and it is extremely rare in the horses. So when we have horses with a diabetic mellitus, we should go for the pergolide, the treatment of choice of the Cushing disease. because here in horse it is country and rare, and dietary management, low sugar and starch intake, insulin may be attempted. So most important, it is in the cat and dog. Okay. Now let's talk about the diabetes insipidus. Insipidus, basically, diabetes insipidus is different from the diabetes mellitus. Here we talk about the water, not the sugar. The body unable to retain the water in the body. So uh, it affect on the water retention, not the sugar. So most important clinical sign is polydipsia and the polyuria. There are different types of diabetes insipidus. I'm audible? Doctors, I am audible?
जी जी
Okay,
आवाज
okay.
आ रही है.
Okay, let's talk about diabetes insipidus. So I already talked about, here we talk about the water retention, and there are different type of diabetes insipidus: central, DI, and nephrogenic. So in central DI, decreased production of antidiuretic hormone from the posterior pituitary. It is a part of brain hypothalamus. And nephrogenic DI, kidney are unresponsive to the ADH. So in central DI, the problem is in the brain, pituitary gland, antidiuretic hormone not produced. And in nephrogenic DI, the problem is in the kidney. The pituitary produces ADH just fine, but the kidney does not respond it. So how will diagnose? We will go for the uh, stepwise. First, we have to go for water deprivation test. Water deprivation test differentiate between the psychological polydipsia from the diabetes insipidus. So, in case the urine is dilute, and how can we differentiate it? First, we go for the water deprivation test in the supervision, that kidney is okay or not. If kidney is okay, it will ultimately uh, concentrate the urine. Otherwise, it will not concentrate if it have diabetes insipidus. And then we go for the other test. Okay, this is the water deprivation test. So if urine is not concentrate after the water deprivation, we will go for the uh, differentiate between the central DI and the nephrogenic DI. So in central DI, basically the hormone, if uh, not produce in enough form in nephrogenic DI, the kidney don't never response to the ADH. So treatment for the central DI is analog of the antidiuretic hormone, and sportic care for the nephrogenic. The prognosis of the nephrogenic DI is poor, but for central DI, we can give antidiuretic hormone or the analogs. This is a diabetes insipidus. So now talk. Let me check the table. So in diabetes inspired dog and cat, we use analog of ADH like desmopersin, or synthetic analog of ADH. Treatment for the central DI only. So alternative options are thiazide or diuretic. For nephrogenic DI, they induce mild sodium depletion, which promote water reabsorption in the proximal tube, reducing the volume of the fluid reaching the ADS sensitive distal tube. So only the test name is important here. In horses, this is extremely rare. So we will not talk about in the horse. Now, Cushing disease. Actually, this is a state of the excessive cortisol released from the kidney, and cortisol affect all the system. So this is very important disease. So in hyperadenocorticism, Cushing disease affect on the cortisol level. It may be pituitary dependent and adrenal tumor. So if there is a problem in the pituitary, there may be the pituitary cause. If there is a tumor in the adrenal gland, there is excess production of the cortisol. So in pituitary dependent, 85% of dogs, there may be a tumor on the pituitary gland. So overproduction of the adrenal gland. So and adrenal dependent, 15% of the dog. This percentage is important. A tumor on the adrenal gland produce excessive level of the cortisols. So clinical signs are important. You can see a horse or dog have port belly, have all four P's: polydipsia, polyuria, polyphagia, port belly appearance, painting. And if we go for the CBC or liver test, there is a ALP increase. This is most important. ALP is common in the dogs. So if animal have all the signs with the increased ALP, we can go for the Cushing disease. There are a lot of screening tests. We will discuss one by one later. So there is elevated ALP, cortisol, and stress leukogram. This is important. So you may have a case have high ALP, cortisol, and stress leukogram, and polyphagia, polydipsia, polyuria, port belly. So you there may be a Cushing disease. Now discuss the different test confirmation. We go for the ACTH stimulation test, and actually the test tell about the pituitary gland is okay or not. If there is a problem in the pituitary gland, and after the injection of the ACTH, there is no effect. If there is a problem in the pituitary gland and we inject ACTH, the problem will be solved. So this is the ACTH stimulation test, and then we go for the low LDDS suppression test, and we also go for the HDDS suppression test. Basically, the steroid decrease the production of the cortisol. So when we inject steroid, the cortisol level decreases in the normal condition. But in this condition, if there is a problem, the cortisol level is not decreases so efficiently. So in ACTH, when we inject ACTH, the cortisol level is exaggerated. Cortisol increase is high. So kidney is hypersensitive to the ACTH, and it confirms the diabetes insipidus. And in LDDS, when we give steroid, the cortisol is not significantly decreases. So if LDDS is not work, we go for the high DDS suppression test, HDDS. And LDDS and HDDS differentiate the nephrogenic and pituitary cause. So this is important. So treatment is trilostane, commonly used, metotane. These drugs are important, and surgery for the adrenal tumors. So in dogs, we use trilostane. These drugs are important. You have to remember. And okay, and alternative options is metotane. So basically, ACTH is monitoring test, and in cat we use trilostane. This is important in horses. Basically, it is a condition of the horse. Maybe there is a horse with the port belly, and there is confirmed question from that. So they may ask from purpose of the different drugs like pergolide. So we use this drug in the equine cushing. Uh, PPID is a dopamine deficiency disorder leading to the pituitary hyperplasia. Pergolide is a dopamine agonist that suppresses pituitary hormone production. We use cyproheptadine. Basically, it is used for anorexic conditions. A serotonin antagonist with the historical use less effective than the pergolide and now consider a second line agent if pergolide is not tolerated. This is all important. Wait a second. So let's talk about ACTH again. For example, in ACTH stimulation test, you have to take cortisol from the blood, then inject synthetic ACTH. Then you have to check the cortisol level after 1 to 2 hours. In normal condition, the cortisol rises moderately, but if there is a condition or a pathological condition or Cushing disease, the cortisol level increases spontaneously. Okay, and in LDDS, uh, basically the cortisol is sensitive to the steroids, and it is more sensitive than the ACTH. First go for the ACTH, then LDDS, then HDDS, stepwise. And it helps distinguish between the pituitary and adrenal cause, same like at HDDS. So any question from that topics? Then we go for another. Let's talk about the Addison disease. It is the opposite of the Cushing disease, and basically the deficiency of the adrenal hormone here, cortisol and the aldosterone. So it may be pathological, immune-related, or congenital. We know cortisol handle the stress, and aldosterone regulate the electrolyte like sodium and potassium. So if there is a low level of cortisols and aldosterone, there is a changing electrolyte, more sodium loss and high potassium retention may cause bradycardia. So immune-mediated destruction of the adrenal cortex. So adrenal cortex will not produce cortisol and aldosterone. So basically the uh, illness, bradycardia. This is important. Waxing and waning. It will come and go. For bradycardia due to the hyperkalemia because kidney is unable to excrete the potassium. This ratio is important. A decreased sodium to potassium, indicating low sodium and high potassium level. Diagnosis is same like above. ACTS stimulation test shows a flat or absent rise in the cortisols. Okay, and here ACTH is definitive test. If we inject ACTH, there is no rise of cortisol, then this is the Addison disease. If there is a changing in the cortisol, so this is not Addison disease. because here cortisol and aldosterone is not produced, so it will so ATCH stimulation will not work here. So after injection of ACTH, there is no rise or increase of cortisol. So and it is the definitive test of the Addison disease. This is important. So treatment is basically the intravenous fluid and steroid injections. Long term, we use fluorocortisone with prednisolone. Okay. Any question? Now, you have to remember the thyroid disorders like hypothyroidism, hyperthyroidism. We already talk about in pharma like cortisol, calcitonin hormone. So here we will discuss only two conditions: hypothyroidism and hyperthyroidism. So hypo is not in the cat and hyper not in the dog. Basically, in hypothyroidism, it is a condition of the dog. There is a low production of the thyroid hormone T4, mostly the T4. So metabolic. This is the metabolic disorder, and the thermostat function is broken. So everything thing is slowed down here in hypothyroidism. T4, low thyroxine levels and high thyroid stimulating hormone level. Treatment is this drug is important. You have to remember levothyroxine. This is a synthetic thyroid hormone. So lethargy, weight gain, mental illness, mental dullness, intolerance. These are the signs of the hypothyroidism. There may be the bilateral alopecia. This is also important. There is a bilateral symmetrical alopecia on the tail and the tragic face and facial puffiness. I will add later on. There is a bilateral symmetrical alopecia, red tail, and the tragic face, puffiness. Treatment is levothyroxine. So how can we diagnose? Like we can go for the serum T4 total or high TSH. High TS is the confirmatory test here. High TSH. Basically, thyroid stimulating hormone indirectly is work on the T4 and decreases the function of the thyroid gland. If there is a high TSH, there is a low T3 and T4. So this is the confirmatory test, thyroid stimulating test. Okay. So hyperthyroidism primarily in the cat. This is the condition of the cat. Here is the overproduction of the T4. So metabolism is high. There is no fat, and the patient is not obese, never obese. So what are the clinical classical signs? These are the weight loss, despite increased appetite, polyphagia, polydipsia, polyuria, hyperactivity, tachycardia, fast heart rate due to the faster metabolism, hypertension. Diagnosis is elevated total T4. Here is important. Serum total T4 is the confirmatory test. Serum total included the free T4 in the plasma and bound protein T4. So we have to go for the total serum, or we can go also for the T4. But total T4 is the confirmatory test. So treatment is methimazole, radioactive treatment. This is important. Methimazole. Methimazole is not a treatment. It is long. If it basically uh, distinguish the different condition from the kidney and the thyroid condition. We should consider methimazole until we confirm the patient have hyperthyroidism or not, because it is long-term treatment, so it is not feasible. So we go for the radioactive and the surgical thyroidectomy. So final treatment is the surgery and the radioactive iodine therapy. Methomazole is for short term, and it is not a proper treatment. So here are some questions. Okay, hypoadenocorticosis corticosis addiction disease. In dog, we use glucocorticoid replacement. Of course, there is no cortisol and aldosterone, and fluorocortisol. And in cat, this treatment is same as for dog. Treatment is same here. In horses, it is extremely rare. And in dog, hypothyroidism, it is a condition of dogs. We go for the levothyroxine. You have to remember the name. And in a horse, not recognized clinical condition in adult horses. So this is not important here. In hyperthyroidism cat, we go for the methimazole first line management. We can go for the thioryl antithyroid drug that inhibit the thyroid hormone synthesis. We can also go for the surgery too. We surgically remove that gland that overproduce that hormone. So here radioactive iodine 131. You have to remember the 131 name. This is the gold standard. Single injection destroyed hyperfunctional tissue without harming normal tissue. No anesthesia required. So no anesthesia required. Surgically is thyroidectomy. Curative but requires anesthesia and risk management. And so first priority is the radioactive iodine 131, and after that we go for the surgery. And methimazole is not a proper treatment. It is for the short term and it is not curable. So first we give methimazole for the short term. Then the checking the after checking the condition, we go for the radioactive iodine. So I will share link after 5 minutes. Okay, and we will discuss some epidemiological terms, and we will finish that lecture in 10 to 20 minutes. Okay, meeting is going to end. Any question from here right now? Any question from these four conditions? Okay, actually 40 minutes is going to, so I am sharing again. No question.
सर
Yes.
एसीटीएच में जब हाइपरथायरॉयडिज्म हाइपर नहीं एड्रीनोकोर्टिसोन हाइपर इसमें जो है एसीटीएच की जो हम जब हम टेस्ट करते हैं उसमें ये काजेज होते हैं नाइट्रोजेनिक काजेज ये कौन से होते हैं
Adrenogenic causes basically it affect on the hormones production. You are talking about Cushing disease. There is a high
यस
level of
सर
cortisol. Basically, ACTH affect on the kidney. It affect on the kidney and allow to increase more cortisol level. So androgenic cause is from the brain where the hormone is producing. Okay, ACTH maybe from the kidney. from cortex where cortisol is produced. So this is the androgenic cause that basically involves the hormones.
सर आपकी आवाज नहीं क्लियर आ रही है, डिस्टॉर्शन हो रही है।
अब आवाज क्लियर है? हेलो? हेलो? आवाज क्लियर है?
अभी आ रही है, बीच में चली गई थी।
ओके। बस ये है कि ना, जो एंड्रोजेनिक काज वो है जो ना हार्मोन्स बेसिकली इन्वॉल्व होते हैं जहाँ पे, ठीक है? तो
जी।
मोस्टली ब्रेन, पिट्यूटरी ग्लैंड। मैं ना लिंक शेयर करता हूँ, तो हम ना एपिडेमोलॉजी की कुछ टर्म्स पढ़ लेते हैं, कुछ एमसीक्यूज कर लेते हैं, ओके? फिर ये मीटिंग खत्म होने वाली है। थोड़ा सा ही है, 10 मिनट का। ओके, तो दोबारा ज्वाइन करना, मैं दोबारा लिंक भेजता हूँ।